Well, we're thrilled to have with us today Dr. Joshy Jacob, who has become a great friend of the city. Many of you will remember that we created an advisory panel back when the coronavirus really came on the scene in our area. I gathered some people from Tucker, related to Tucker, who have expertise either in medical background, some community leaders, business leaders, to kind of get all perspectives on what we were going to need to be able to respond to this pandemic that we've been fighting for several months now. So I have with us today Dr. Joshy Jacob, who's been a really important part of that. And we're going to have a little question and answer, and hopefully he can address some things that'll be practically helpful for everybody. But first, let me ask you, Dr. Jacob, tell us what you're a doctor in and what's your professional expertise. What do you do for a living?
Mayor Frank, it's such a joy to be here. I have a PhD in microbiology and immunology from the University of Maryland School of Medicine in Baltimore. And then I did a 6-year postdoc at MIT. And then I came to Atlanta and I got my faculty position at Emory University School of Medicine, and I've been there ever since. And I'm currently a tenured full professor. And I do research on antibodies to viral infections, and I also try to make antivirals for viral diseases like dengue, influenza, Zika, and now we work on coronavirus cures.
So this is something that you've been devoted to professionally for quite a while now. Maybe not this virus, but similar outbreaks in the past.
My lab has been working on viral immune responses for about 20 years or so.
Well, so tell us, I guess first of all, I'm interested in now, after several months of fighting this, you've been researching it. Tell us the latest of the understanding of how coronavirus spreads, and especially maybe how it relates to seasonal flu, other things that our listeners might be familiar with.
So let me start off with the differences. So seasonal flu, you get the flu, you are sick for a few days, and then you get better. And just about everyone who gets the flu actually gets ill. You're not well and you know you have the infection. But with this coronavirus, about 80% of the folks who get sick just do not know that they're unwell. Especially if you're very young, you can have a lot of this virus in you, but you will have no overt symptoms that you know that you have it, and consequently you wind up unknowingly giving it to other people, like your friends and your family and your grandfather and people like that. And in terms of cures, there is a medication called remdesivir that has been approved for use for this virus. And there are also many other drugs in the pipeline. There's also vaccines, about 52 of them that are under clinical trials in different parts of the world. And realistically, next year this time, we would still not have everybody vaccinated. It's just because there's not enough time to make a successful vaccine and to have enough doses to cover the entire population. And when Fauci says that, Dr. Fauci says, we are going to be in the same boat for a while, I have to agree with him from a scientific perspective. And so the question is, what do you do in the interim? How are you going to protect ourselves? And what we have to do in the interim is to follow the CDC guidelines. This is a respiratory virus. So what you need to do is to cover your nose so that you do not breathe the virus in, and make sure that when you touch surfaces, you clean your hands and so forth, so you don't actually touch somewhere and put it in your mouth and then you get infected. But the majority of the infections come by you just breathing it in. So that is the trouble with this virus. And so the mandate has been, not the mandate, the recommendation has been to wear a mask in a public place. And I strongly recommend that we do that. And countries that do that, especially like Japan and so forth, where they wear this anyway, when you travel to Japan, almost everyone has a mask on. And it is good to wear one because you protect not only yourself, I make sure that I do not give it to the mayor when I come to see him by wearing it. And right now I'm not wearing one because I am about 20 feet away from him and it's not a problem. But when you are within the distance, it's safer to put the mask on than not wearing one. And there are a lot of YouTube videos and Facebook videos that actually show studies that show if an infected person wears a mask and does not wear a mask, what the consequences are, and you have seen this, so we will not get into it. But ultimately, preventing transmission is what we have to do. And that applies to how all these businesses are opening up and so forth.
So you mentioned remdesivir, some of the other drugs that are in the pipeline. We've seen, even in this current recent increase in the number of cases, it seems like hospitalizations, stays are shorter, deaths are down. Is that related to these medicines, and what do we take from that?
I think the hospitals have gotten very good at managing patients, and unlike when we first started, we know a whole lot more on patient management, and that's the reason why the death rates have been lower. And also there are experimental drugs that different hospitals are trying on patients as well. But ultimately, you will need to go back to life as it used to be before 2020. You need an antiviral, and also, but more than that, you need a very effective vaccination so that we can vaccinate people, and we have herd immunity, and we don't have to worry about this virus coming back and infecting us.
I heard Dr. Fauci the other day make a comparison to how you have chickenpox maybe as a young person, and there's an effect much later in life where you can have shingles or another disease related to the same virus that sort of stays in your system or has effects many, many years later. I've heard you say some things that are frankly a little frightening about the possibility of something like that with this one. Can you tell us what the current state of understanding is about?
So it is unclear whether the coronavirus stays latent in a person who has gotten over the infection. So I don't think that's a fair comparison, but what he's probably referring to is the consequences of actually getting sick, because when you get flu and you get better and it's over. But when you get coronavirus and you get really sick, there's long-term consequences that one has to face. Not in everyone, but in those patients that get really sick. Because now we know that you have massive inflammation, you have lung infections, you have maybe the incidence of type 1 diabetes, you have all kinds of other problems. When they do autopsies in patients who have died with COVID-19, they find evidence of this microclots all over in most organs. So there are a lot of things that happen as a consequence of infection with this virus that we do not fully comprehend at this time. And that's the reason why this urge for caution, as you're better off not getting it than getting it, and having the possibility of getting a severe infection and the sequelae that follows.
So back to the importance of wearing masks and avoiding getting infected to begin with, if it's possible at all.
You don't want to get this. You want to wear a mask, do everything necessary to make sure that you do not get the infection, so that once the vaccine is in place, then we go back to life as normal. And businesses need to run. That's all for sure. But we need to figure out in the interim how to run these businesses with all these precautions in place. And we can actually do that. If everybody wears a mask and is careful, then I don't see any issue as to why we cannot operate businesses. But I have to tell you, dining in would probably not an option. But then we are creative. We do other options so that this business can run and the people that work there can make a living, and we can prosper and move forward.
So what, clearly distancing yourself, so if you can stay at home, if you can stay in an isolated work environment, that's the first thing. And then if you have to be near people, always have a mask on. That advice has been around for a while. Do you have any sense of what's behind the current spread? Is there any one thing we can point at, or is it a general sort of relaxation, or I don't know, people getting tired of isolating and quarantining and so on, and just not being as diligent with the precautions?
I think it's like life. There are things that you're very afraid of, and with time, you're not so afraid of it anymore. And with times, as time goes by, your guard goes down, and you didn't catch it this far, and so you probably think it's fine. I think the most critical thing is if you have young folks in your home, your 20-year-olds and your 25-year-olds, and they need to be told that you have to be very careful where they go. They go see their friends. You have to really protect yourself, because they will be asymptomatic. They'll bring it home and give it to your parents and grandparents and things like that. Intergenerational mingling, at least in Italy, was a big factor in getting all the older folks getting infected by the kids who would bring the disease from their workplaces to their home.
So as we've talked on our advisory panel, and we intentionally put together a group from different disciplines and different backgrounds, different sort of roles in dealing with this. You've been very good all along to say, I'm a medical professional, I'll contribute in that way. Now we're coming up to decisions about schools and children going back to schools. In some places, some cases, the parents have a choice. In any event, they're having to make a choice for themselves. So, not for the sake of policy making, but from a medical point of view, as children are back in classrooms or pondering being back in classrooms, what comes to mind right away that you would say in terms of medical advice to protect from infection, from spread? Are there some basic things you would tell us to be careful of as parents and individuals?
So, if we all complied by the recommendations, then I think it is possible to live with this virus. But if you have a student who is 5 years old or 6 years old and is in kindergarten or first grade, it's very difficult for them to follow the guidelines like you and I would do, and that is a problem. But in the bigger classes, if you can get them to be diligent about wearing a mask at all times, then I think we should be able to move forward and have the classes and so forth. That's just my personal opinion. And at some point, we'll have to learn to live with this. And that's what, as time goes by, that's the realization. You can shut things down, that is true, but we need to have a smart way by which we can deal with it and live with it. And I think if you follow the guidelines, then I think we should be able to do it. I've been working at Emory University for the last 4 months during this pandemic, and the rules are very strict. We wear a mask, and we don't have any breakouts in the department that I am in, and that's because everybody is conscientious about following the rule of law. And wearing a mask somehow does not diminish your courage or anything like that. And there's this false sense that has gotten into people that if you think you're weak, then you wear one and so forth. You just don't want to get this virus. It's not a good one. And if you're in the 80% that just asymptomatic, then you're probably okay. But if you're in the 20% that gets really sick, then you have not just short-term issues, but you also have long-term consequences as a consequence of getting this severe infection with the virus.
I want to go back to schools for just a second, because I heard, I think it was Dr. Toomey the other day on a call, the head of Georgia's Department of Public Health, was asked a question about schools, like if in a classroom there is a positive case, is everyone in that classroom going to have to be quarantined, shut down, maybe broader than that, a whole school or building at a school? And her answer, I believe, was that no, not necessarily, because of contact tracing. Their sort of threshold would be 15 minutes of close contact with the infected person. And so they would attempt, I think, to sort through that and find those who were most likely to be infected and maybe not have to quarantine others. Is that standard understanding now, or you have a reaction to that sort of protocol?
That sounds reasonable, and what I would think would work better would be if you had a short-term quarantine on the folks that got exposed in the classroom, and you tested them, and then for 3 consecutive times, and then if they're negative, they just bring them back again. That's what you'd have to do.
Is there a certain waiting period? If I think I was exposed to someone today, Is there a time I need to wait before I get tested?
The incubation time is about between 5 and 6 days before you show viremia. Actually show virus presence in the nasopharynx. So about a week's time would be what you would take to do it. And remember, these are young people, they will be asymptomatic. But the problem is then you have the teachers, and if you knock out 10 teachers, the school just goes down. You cannot open it up anymore.